right, welcome to the next installment of the Many Minds podcast, where we encourage collaborative community healthcare using many minds for better outcomes. I am your host, Alex Davis, physician assistant, alongside
Tyler Murray, nurse practitioner.
Perfect. We both work together at Summit Brain, Spine, and Orthopedics in Lehi, Utah. The purpose of the podcast is to promote interaction between specialties and dig into what makes your specialty special. I want to talk about the stuff we don't usually get to talk about as healthcare providers. What is life like in your shoes, and how can we support what you're doing to provide better care for your patients?
General disclaimer, this podcast represents the opinions of myself, Alex, and our guest on the show. The content from this podcast is not intended to substitute for professional medical advice, diagnosis, or treatment. We're just here to learn and have a good time. With that, we'll jump into it. Carson Homer, thanks for coming on the show today. We appreciate you taking some time to speak with us. Why don't you go ahead and just talk to us about your world? I know you're in urgent care, and it sounds like you were in urgent care kind of right out of graduating from PA school. So tell us kind of where you're at and what's transpired since graduation until now.
Yeah, I graduated actually with Alex. We went to school together.
We sure did. We bonded real early. Right at the get-go of our PA program, they have a class called Surface Anatomy.
Okay.
So you're learning anatomy based off of what you can see on the surface.
Got it. And
our instructor likes us to use Sharpies and actually draw the structures that are under the surface. So
we got to draw things all over each other.
Yeah. Wow. You guys got intimate real quick.
We're bonded forever because we've circled each other's nipples. So
yes. Well, that's one way to break the ice.
It's a tough bond to break. Yeah. Well, anyway, sorry, he had a question for you.
Yeah. So after we graduated, I actually worked construction for a couple of months until I landed the job that I wanted.
Yeah.
I used to work in emergency care as a trauma tech in the ER, and so I always thought I would be in emergency, and so I was looking for urgent care experience, and I applied at Revere Health in Provo, and actually started as a PRN at all of the urgent cares, and then they quickly after a couple of months pulled me in full-time at Provo Urgent Care. So
is there a training program? Did you have to have formal training to be in that setting, or did you kind of just jump in?
What's the intro
first?
like? Somebody getting started in Instacare?
There wasn't really a formal training. I had a PA that did train me there. At Provo, mostly, I did a training shift at each of the locations within Revere's Urgent Cares, Salem, Spanish Fork, Eagle Mountain. But I worked most of my shifts at Eagle Mountain and Provo. But yeah, I had a PA there at Provo that I kind of followed around, and he supervised me for several weeks, and then kind of jumped right into it once my credentialing all went through.
Nice. Is that a tough transition? Do you think that's a reasonable job right out of school, urgent care?
Yeah, I think so. I think the best thing about urgent care is it's so broad. I got to see a lot of different things, and use all of my education. And so it was nice to kind of have that broad introduction to medicine. It was daunting at first. And I kind of had that imposter syndrome, didn't feel like I fit in. Like, wow, like I can prescribe medications now. Like all of a sudden it's like, there you are.
Yeah.
But it clicked a lot quicker than I thought it would. It was a kind of an easier transition than I imagined it would be. And yeah, it was smooth after that first couple of weeks.
What, doesn't come without challenges though, I assume.
No, definitely doesn't come without challenges.
What are the stumbling blocks, or what's the difficult stuff that you guys deal with?
It's a good question. I kind of got thrown into the fire when I started in urgent care.
Sure.
So a couple of months after I started, both of the full-time providers, so they only had 2 full-time providers, and they alternated days. They would work 8 to 8, 3 days a week. So I worked 3 12s. And then they added my position because they wanted to add a second provider from noon to 8, Monday through Friday, and then 10 to 6 on Saturdays, so that we had extra coverage because we were getting really busy, seeing a lot of patients. Shortly after I started full-time, both of the full-time providers quit. And so it left me. And I ran the clinic
tag, you're
essentially by myself for about 3 months while I trained more staff. And I was working 5 or 6 12-hour shifts a week.
Wow.
Not making overtime.
Dang it.
They paid me what's called moonlighting pay.
Yes.
Yeah.
Just a base hourly pay. But yeah, so I got thrown into the fire and had to learn real quick. And I was training new nurse practitioners and PAs that came right out of school, having just started there myself 5 months previous.
Wow.
Yeah. And yeah, so it was a roller coaster.
All right, here's a question. Who's harder to train, nurse practitioners or PAs?
That's a good question. I've trained mostly nurse practitioners, actually. Only 2 PAs. And I think each have their own skill sets.
I think that's right.
When I started, I had never given an injection medication as a PA.
Yeah.
Now nurses, they've been giving
That's
injections
that's
all
what you
the
do.
time.
Yeah.
And so I remember having to ask my nurse practitioner colleagues, hey, so like, is this something that I need to push slow into the IV? Is this something that we can just shove in there? And so it was kind of a quick learning curve that way.
Sure.
And it was nice to have nurses that had that background. But yeah, I think it was about the same. I've had some great experiences with a lot of our great nurse practitioners that jump in running, and the ones that really thrive in urgent care have been those that had experience as emergency nurses.
Yeah, I feel like it's a niche thing. Niche, however you say that word.
Niche?
But yeah, I feel like emergency medicine, urgent care medicine, it's like a certain type of person where they thrive off of that. A little bit of unpredictability, a little bit of a varied schedule as far as what your patient load is going to be like each day and what kind of conditions you're going to see. And it seems like some people thrive off of that.
Yeah, it definitely takes a special personality, and you have to thrive in you don't know what's coming next and just be quick on your feet, because urgent care is a lot more low key compared to emergency medicine. We're not seeing the big traumas. We're not dealing with a lot of those things, but we see just about anything in the urgent care. I mean, anything. We'll work up chest pains. I've diagnosed appendicitis and direct admitted them to surgery. So we do all of it. The only thing that we really send over to the hospital is strokes and MIs.
Yeah.
And being in a big organization, you have a lot of resources around you.
Yeah,
I'm always
do.
interested to know, though, how much autonomy do you feel like you have in the urgent care setting? Are you pretty much taking care of business day to day by yourself, making decisions? How much interaction do you have with the physicians there? Like, kind of tell us what that's like.
Yeah, there's a lot of autonomy. I feel like I spend a majority of my day just working on my own, and sometimes I'll be several shifts without talking to my supervising physician. She's there in the office, and she oversees a full family medicine clinic as well as the urgent care. She's there to consult anytime. She's been a great mentor, Dr. Heather Harrison, and she'll answer a phone call first ring almost every time. If she's not, it's probably because she set her phone down for a second.
Yeah.
Or she's delivering a baby, because she does that too.
Yeah.
But most of the time I feel like I consult sometimes with my colleague that's working the urgent care with me. If there's any questions, or it's like, hey, I just want to bounce ideas off of you. Is there anything that you feel like I've missed? Which is really nice. But if there's ever anything that I'm like, wow, this is way over my head, then I'll go and talk to my supervising physician and bounce ideas off of her. And sometimes she's like, you know what? I don't know. Let's go this direction and do this, this, and this.
Love that.
And most of the time it's things that I've already presented to her.
Sure.
And she's like, yeah, I think you're on the right track. Let's do
Awesome.
that.
Yeah, so get some good support. We had a conversation just recently with our surgeon, Dr. Edwards, presented in our weekly meeting about cases that are urgent and emergent in spine care, and which ones are appropriate to go to
Urgent care
versus ER and that kind of thing. What do you see in your setting? What are the things that you feel like other providers need to know about urgent care? What's appropriate to go there? What's appropriate that should probably just go across the street to the ER? How would you phrase that? Or
That's a tricky question, because one of the things that we actually started a protocol that we've worked up with cardiology is chest pain. chest pain's a big one. And 95% of the time, that chest pain is not an MI. It is not something that needs to go to the emergency room. And so we've actually worked up a protocol with our cardiology department on what we do when they arrive. We triage them quickly. We get them back. We ask them a series of questions, and do an EKG. And if it's a STEMI, if it's an MI, then we're sending them over to the ER. But if it's not, I mean, a lot of times it's GERD or anxiety or chest wall pain or muscle soreness. I had one guy that came in that was having this severe chest pain, and we got talking to him, and he had done a big chest workout the day before, and he was really
just
sore. And I just like pushed on his chest, and he was...
You overdid it.
Right on the coracoid. Ow.
And I'm like, okay, if I'm just pushing on the muscles of your chest and it hurts, this is not your heart.
This is your first time working out?
Yeah.
And so that's one thing that people always say, and we used to do that. We used to say, you know what, you come in with chest pain? Sorry, you got to go to the ER. And cardiology was like, wait, hold on a minute. Why are we sending every chest pain to the ER when that's most of the time it's not a heart attack?
Yeah. What do you guys feel like you excel at? What's the best patient that you guys get to see?
Oh man, we see all kinds of things. I love procedures. I love suturing. So I stitch up a lot of patients. I always thought I would be bored with the mundane things, the colds and the flus and the UTIs and things like that. But honestly, nowadays I'm like, oh good, it's just a cold or it's just a UTI. I don't have to put a lot of brain power into this one. And it kind of is an easy flow to my day, as opposed to the complex, okay, you've got severe abdominal pain, fevers. What are we doing with you? We're getting CT scans. We're thinking through this mental process. And so sometimes it's nice to have the mundane, but it's nice to be challenged as well and work up big things too.
Yeah, for sure.
And along that, maybe in a different topic, I want to talk about pay for a minute.
Yeah.
You can disclose as much as you are willing to, but just want to get a sense for our listeners what a PA or a nurse practitioner in an urgent care setting should expect to make, either starting out, once they become more experienced. To your knowledge, what would that look like?
Yeah, for sure. Based on my experience, I would say starting, and I mean, this was 4 years ago, anywhere between 90 to 100,000. You're probably closer to 100,000 these days with inflation and things like that. And making anywhere between 100 and 120 within those first 5 years. That's for full-time salary. Hourly, anywhere between 45 an hour to 55 an hour, I think would be average, at least in our urgent cares.
Yeah. But
and depending on your experience too,
Sure.
if you've been there for years and years and you've been through their raises and pay scale increases, then you're...
Yeah. And with that, always the counter to the salary argument is just the lifestyle balance.
Yes,
and the other perks and benefits come to that.
And
what's your lifestyle balance like?
My lifestyle balance is great.
Yeah.
I work 3/12s. I'm in the office 3 days a week. I get to be home with my kids 4 days a week.
That's
my
awesome.
wife also works full time. She runs a business, and our life is busy. But we're able to juggle it together because I get the opportunity to be home and be a stay-at-home dad for 3 or 4
All
days
the
a
nurse
week.
practitioners listening to this will appreciate that, because they've been there. You know, the 3 12-hour shifts per week was considered full-time. And I remember going from a 3-day work week to 5-day
work week.
It's a big change.
It is.
You take for granted those 4 days you have off, and it allows you so much time to do things. I think one of the biggest struggles we have is, like, we work 5 days a week. It's maybe one of the downfalls. We do have some time off here and there, but it's like going to appointments and just doing all the daily stuff.
Just trying to be available during business hours.
Exactly.
Get your own doctor's appointments.
Exactly.
So there's a sales pitch for the urgent care setting that you can really have pretty nice hours if you're willing to work. Those are long shifts, though. 12
They are
hours.
long shifts, and honestly, they're not 12-hour shifts. They're more like 13-hour shifts. The clinic is open for 12 hours.
Yeah.
And we lock the doors so we open at 8 a.m. We lock the doors at 8 p.m. But if I had 10 people check in at 7:55,
You got to finish it out.
I'm stuck there.
Yeah.
The latest I've been in our urgent care is about 10:30. But most of the time, I would say 99% of the time we're out by 8:30.
Do they recommend you do the shifts back to back, or is it?
We don't really have a preference. I mean, some people do shifts back to back. When I was working 5 or 6 shifts a week, I think the longest I went was 13 shifts in a row.
Oh, wow.
And it sucked. And I didn't see my kids for 2 weeks straight. But that I just kind of buckled down and did what I had to do. But it moved me into a good position because now I'm senior in the clinic. I now have 7 nurse practitioners and PAs that work on my team, and a dozen MAs that I manage all of the schedules, and I get to pick my schedule, which is helpful. I get a 4-day weekend every other week, and that's nice.
So that's awesome. And you've been in practice how long again?
4 years.
So that's a 4-year. Yeah. That's quite.
That's
a lot of growth in 4 years.
Yeah.
That's pretty impressive.
It's busy, but the schedule's a nightmare sometimes, making 7 providers happy with their schedule, but it's a work in progress for sure.
Speaking of relationships, though, I feel like in that setting, you probably get to communicate and interact with most everybody.
Absolutely.
I mean, how does that work for you? How do you get to know people? What specialties do you feel like are crucial for you to have relationships with?
I think all the specialties. It's not within Revere. We have almost every specialty, and I think the only one that we don't have is podiatry. And
I know the foot and ankle guys too, though. You've got orthopedic.
We've got orthopedic. We've got everything. And I mean, Dr. Hoops is one of our foot and ankle specialists. Dr. Hoops and Dr. Fox, and they're great to work with. Dr. Hoops is amazing. He'll take a call from me any day. I can call him, text him anytime, and he's always open for a consult. He's happy about it.
Awesome.
I give him all my referrals because he's available.
Yeah.
And he never complains about a call, even when he's not on call. And he's not always on call, but he said, you can call me anytime, especially if it's one of my patients. He's like, even if I'm not on call, you have my cell phone number, text me, call me anytime. And it's always great to have those resources. Cardiology is a good one. We have their call schedule. I have all of their phone numbers, and so I can look up who's on call. I can call them anytime and for a consult. I just have a question about a patient. I have a question about an EKG. I'll text them a picture of it or message them a picture of it on our messaging system, and they can take a look and be like, yeah, this is concerning to me, or this isn't concerning to me. Let's follow up in the morning in my office. So I save a lot of people from going to the ER that way too.
Nice. That's awesome.
What about continued education? What does that look like for you in your world? How are you staying up to speed on all the latest and greatest?
So we have a continuing education requirement as PAs. We have to do 100 CME credits every 2 years. 50 of those credits have to be an advanced level credit. But a lot of my continuing education is going to conferences. I love the Summit Spine Conference. I've gone to.
We were hoping you'd say that.
All of them over the last 2 or 3 years.
Yeah.
Alex has been great to invite me out to those things, and I think my wife's actually going to come with me this time around.
Awesome.
She's a massage therapist in the area, and she does a lot of injury work.
Love that.
But yeah, it's so conferences. I use UpToDate as a great resource for up-to-date information in medicine, and I use that every day. So that's a great resource, and they actually have continuing education credits on UpToDate, so I can actually go and log the articles.
I just had to renew my license and use the majority of UpToDate credits for that.
That's right.
So I definitely.
Yep. Yeah. So I use UpToDate a lot for most of my credits, but it's a great resource, and I'm amazed. I always try to look in UpToDate because things are constantly changing. Yeah. One of the things that I noticed early when I started was the treatment for diverticulitis. It used to be antibiotics every time, and they've kind of actually moved away from that. We don't even treat diverticulitis with antibiotics anymore. And that was something that I noticed in UpToDate. I had a patient say, hey, well, what about my antibiotics? I've been getting antibiotics for these flares all the time. And I was able to educate them on the new up-to-date information and say, you know what, we're going to hold off
awesome.
on that, but let's watch it closely. If we need to jump to antibiotics, we will.
That's awesome.
Anytime my wife's sick, I go to up to date.
Yep.
And I just start researching and say, yeah, well, based on what they say, this is what we're going to do. You know?
Yeah, it's a
That is
helpful
super helpful resource.
And I often turn back to stuff that I already knew as well, just to verify. Say the last I remember, this was the recommendation for this condition, and it's nice just to have that easy access.
It's a great reminder, though, that things are changing. So
they are changing, so always double check up to date, because something that you've been doing for years may have changed. Another one that's changed recently is the treatment of epididymitis. I've had patients come in, and I always go in just to double check, okay, are we going to put you on the right antibiotic? It used to be based off of your age and your sexual history, but now it's standard for everyone.
Really?
Interesting.
That is interesting. That's good for you to stay up on top of that, though.
Yeah, especially as an urgent care provider. I see that stuff all the time, as opposed to an orthopedic specialist. Like, how often do you treat epididymitis?
Yeah, I could count on 0 fingers.
Yeah.
How many times I've done that. And in our world, being very, very specialized, it's the same things over and over and over again. So we get pretty comfortable and familiar with the things that we see commonly, where you're all over the place. So
yeah, we are all over the place.
You've probably got a lot to stay up to date on. Along that line, I always like to ask, what's trendy? What are the new innovative things, or what's evolving and changing in your world that the rest of the healthcare industry should tune in for?
I don't know. That's
new policies, new procedures, new ways that you're handling things from the administrative side. Any new treatments that you've seen to be very helpful? I mean, we just mentioned a couple of those tweaks and changes, but
some of those changes, I feel like antibiotics are a big one. I feel like a lot of providers that have been in medicine for years and years use a lot of antibiotics.
Yeah.
And that's something that I've seen, that a lot of the recommendations are, you know what, let's hold off. Let's only use antibiotics if it's indicated, if there's a strong indication for it, and not just throwing antibiotics at every patient, every cold. Because they're seeing a lot of resistance and things like that.
That's a challenge, though, in that thinking, because patients come in, they want an answer, but they also want a solution.
They do.
And so when they walk away empty-handed, they're not always
people want
happy.
an intervention.
No,
so there's a business aspect of it too. You know, I shouldn't be saying that, but there really is.
No, there really is,
Patient
because you
satisfaction
want
is
to
a big
give
deal.
patients what they want, because patient satisfaction is what drives medicine these days, and unfortunately, it's not always the best for the patient. And so, one thing that this is another thing that's kind of formed my attitude towards that is, I had a lot of patients coming in with sinus infections. I see sinus infections all day, every day. And they always want antibiotics. And so I actually went and did a bunch of research on sinus infections. I went and looked at the Ear, Nose, Throat Association's recommendations, and they actually don't recommend antibiotics. And so I went and read a bunch of the statistics, and I kind of formed a spiel that I give to my patients that come in wanting antibiotics. And I tell them, let's talk about it. Let's talk about sinus infections first. And then let's talk about the recommended treatment based on years of evidence. And then I educate them on it. And usually they're like, oh, okay, let's try that. And so that's always reassuring and nice when patients get on board with new things, and that I'm able to provide that education and reassure them and say, I'm not going to discount the antibiotics, because some people do need them, but let's try this first. And I've had some patients that they're really just set on having that antibiotic, and I say, I'll tell you what, I'm going to send the antibiotic in, but I want you to try what I've told you for 3 days. If it's not improving, go fill your antibiotic. If it is, then keep doing
Try
what
and
you're
hold
doing.
off. I like it.
Yep.
Yeah, great advice. Last thing we'll finish up here. Best part of the story is a patient story.
A patient story.
I would love to hear your favorite or most memorable interaction you've had through the Instacare.
Oh, man. This is a tough one. I've had a lot of
I can imagine.
fun experiences.
I can imagine.
A lot of crazy experiences. Most memorable, most impactful.
Funniest.
Funniest.
I'm always the guy advocating for the funny stories.
I had a bit, and sometimes it's hard to remember back. I had a patient recently, and this was really fun. My MAs were laughing after I told them the story. I had a patient come in that cut her finger, and I walk into the room, and she's super embarrassed. How did I cut my finger? Little did she know that I had already stitched a couple of fingers that day. And she is so embarrassed, and she looks up, she's holding her finger, and she looks up at me, and she said, "Oh my gosh, I am so embarrassed, and you are so cute." And why does my doctor have to be so cute?
Oh my goodness.
And she turns to her teenage daughter and says, "Don't tell your dad."
Oh my
And
goodness.
so that was one that was really funny recently. And
that doesn't make the situation awkward at all.
No,
it was fine. I was like, "Oh, thank you. I appreciate it. But
don't be embarrassed.
We'll get you taken care of. You don't need to be embarrassed. People cut their finger all the time.
Sure.
I stitch fingers up. Fingers and eyebrows.
Those are the two.
Yeah, those are the two. I mean, probably 90% of the sutures that I do are
on the face.
an eyebrow or a finger.
Interesting.
That's
But
so
that was a funny one.
Awesome. Okay. Well, that's awesome. Thanks for hanging out with us. Tyler, what'd you
Not
think?
a
What'd you learn
problem.
today?
Yeah, so got a little bit more knowledge about the urgent care world. I think we oftentimes think about the urgent care and ER, especially from a neurosurgery perspective, and I think we have our own biases and things like that, but I think you've opened our mind. First and foremost, urgent care, you guys can do a lot. You guys have a lot of resources. I would say it probably depends on where you're at as far as your urgent care setting. It sounds like you've are in a culture where you know a lot of people, you have a lot of resources, and I think that really gives confidence to the community to be able to treat a lot of different things and escalate them as appropriate, which is super nice. I love to hear that you've got a great work-life balance. I'm sure a lot of listeners interested in the urgent care kind of setting are going to be appreciative to hear that you feel like, yeah, you've got a great work-life balance, and it sounds like the pay's pretty competitive. So I think overall, sounds like, maybe I'm going to send out my resume and see what urgent care is all about. I'd have a lot to learn, though, I'll tell you that. So.
That's true. Yeah. Maybe don't pick it up quite as quick as he did.
Yeah. It was nice going straight out of school, too.
Yeah, it's all pretty fresh, actually, the general medicine stuff.
Yep.
Okay, well, how could people connect with you if they wanted to find you and maybe reach out, ask questions, get to know you? Where could somebody find you?
Just
in the office.
In the office. Stop by the clinic.
There you go.
You have an urgent need, come by. If it's not urgent, schedule an appointment with your primary care.
I love it.
Love
okay,
that.
with Revere Instacare down in Provo, Utah. As far as our group goes, with Summit Brain, Spine, and Orthopedics, you can find us on Instagram, Summit Brain, Spine, and Orthopedics, our YouTube channel, Summit Medical Institute, and as always, we'd love to see you in person, Tuesday mornings, 7 a.m., Holy Cross Mountain Point Hospital in Lehigh for our interdisciplinary rounds case presentations. We're grateful for everybody that's hanging out and listening with us. We love your feedback as well. Please let us know what you'd like to hear, directions we'd like to go, and maybe specialties, something that we're missing that we should reach out to and learn a bit more about. Anyway, this has been another episode of the Many Minds podcast, where we encourage collaborative community healthcare using many minds for better outcomes. I'm Alex Davis.
I'm Tyler Murray.
Thanks for listening with us. We'll see you next time.
Protect your eyebrows and fingers.
That's right.